Hello guys, welcome back to the D&N Medical Series. I'm Damar and today I'm here with another tutorial video. Now in today's video we'll be looking on wound healing. So wound is basically breakage of your skin, and this may be caused by abrasion, in Jamaican terms scrape, what we call a scrape, or it may be due to a laceration, and this is what we call a cut, right? So when you get a cut or a scrape, right, this is termed as a wound, and the healing process is basically restoration of the normal state. Now we have a cut or a scrape, right, otherwise called a wound, and the body needs to heal this wound. And it does this in a series of steps, as we've said before. And the first step that we're going to look on is your inflammatory step. So when you get a cut, the first thing that occurs is bleeding, right? So the body needs to stop the bleeding, and it does this via vitamin K and your clotting factors, right? These are present in your blood. So your vitamin K and your clotting factors give the wound its initial stability, right? But this is very weak, and so there are compounds that comes along to strengthen it and to make it more stable. So these are your fibronectin, which cross links with your extracellular matrix, and then a glue fibrin comes along to hold everything in place. So once fibronectin and fibrin comes along, the wound is now stable. The second thing that occurs is your inflammatory response. So fibronectin, your cell debris, and your bacterial product acts as chemoattractant. What this means is that it secretes chemicals, maybe cytokines and chemokines, which cause the body to generate an immune response. So the cells that are involved in the immune response initially are your sprinters, your macrophages, and your neutrophils, which are leukocytes, right? Leukocytes, white blood cells. All right, so these two are important in secreting enzymes such as your proteases and your collagenases to get rid of the cell debris and the bacterial products, and just to attempt to clean the wound. To make it easier, I'll use a burger to demonstrate the initial process. So the bread on the burger has fibers. You know that bread has fibers, right? So the first thing is that the fibrin and the fibronectin along with the ECM, right, stabilizes the wound. The next is the lettuce. So the leukocytes, leukocytes, lettuce, are the neutrophils that comes along. And the next thing, the mayo, the macrophages, comes along to clean up the cellular debris. So that's the first part of the response. So the next thing is your repair and regeneration. So this is basically the replacement of wound by scar formation, and scar formation is the body's way of healing. All right, so it usually heals with a scar, and that's why you get kind of like a scab on a wound, right? This is as a result of scar formation. All right, so scar is formed from collagen, right? And there are two types of collagen usually in the healing process: collagen 1 and collagen 3, right? And proteoglycans along with some fibrin. Okay? The next process that occurs in the repair and regeneration is angiogenesis. All right, and genesis means the beginning of something, right? So this is the formation of capillary buds, which leads to the formation of arterioles and venules from your endothelial cells. So we have something that's called granulation tissues, and it's from which these new venules and your arterioles are formed. So the granulation tissues give rise to sprouting, things like this, sprouting or capillary buds, right? And these capillary buds or sprouts, they lead to the formation of your venules and arterioles, which are small veins and arteries, to give the area blood supply. The next step is to remove the original clot. Now, the first thing that occurs is that epidermal cells present in other areas near to the wound, they migrate to the wound to fill these dermal gaps, and these epidermal cells, they migrate until they reach a point where they see other epidermal cells. So they're like, okay, we're fine, we've already filled all the gaps, we're seeing other epidermal cells, we don't need to continue, right? And once this occurs, there is collagen, usually type 3 at first, that comes along to fill these dermal gaps. And then after 1 week, you bring your other collagen, your collagen 1, which is stronger, and this basically seals off everything. So we're going to finish our burger. So angiogenesis occurs after the macrophages and everything has dealt with the inflammatory response, and there is formation of blood vessels. Just think of blood. So we put some ketchup for the blood. And then remember that your epidermal cells comes to fill the dermal gap, right? And they migrate until they have reached other epidermal cells. So epidermal cells, egg, E for epidermal cells. And then now, after that, we lay down our collagen. So that's our cheese. So we put a lot of cheese at first, right? And then we look and we're like, no, we need more cheese, right? Everybody loves cheese. So then we put one more layer of cheese, which is our collagen 1. So it's collagen 1 that replaces the collagen 3, all right, which is the extra layer of cheese. And then we seal everything off and our wound is fine, all right. So it should be noted that healing may be via primary intention or secondary intention. Now, in primary intention, this is usually for small wounds where the edges are close apart and the body therefore can heal itself. Secondary intention, maybe the wound is a bit wider and so there needs to be some assistance with the healing process. This may be the use of sutures or what we call stitches, glue, or staples. Now, there can be complication as it relates to the healing process. One such complication is a wound dehiscence. And this is basically when the wound is closed using secondary intention and then after a while it opens without healing. The next thing is keloid. So keloid is the formation of excessive scar, and this is due to an increase in the rate of collagen synthesis. So sometimes acum that you see on a person's ears after piercing may be due to excessive scar formation, and this is called keloid in medical terms. That's it for this video. See you in the next one. Bye.